Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about recurrent SIBO. So what is SIBO? Small intestinal bacterial overgrowth, or SIBO, is a condition that occurs when bacteria that are supposed to stay in the large intestine or colon begin to travel up into the small intestine. This bacteria then begins to feed on food in our small intestine, creating a fermentation process that can lead to significant symptoms. A common trend that we see in our clinic is that patients with SIBO usually feel better when they're getting treated for the SIBO, but then symptoms return shortly after treatment ends. So why does the SIBO come back? Here are some of the top reasons why SIBO returns. Low stomach acid or chronic use of PPIs, motility issues, past history of GI surgery, suppressed immune system, or the patient may have additional factors that may be present along with the SIBO that can contribute to very similar symptoms, such as food sensitivities, yeast or candida overgrowth, parasite overgrowth, low stomach acid, like mentioned above, low digestive enzyme output, poor gallbladder function, and more. On a side note, we found that mold exposure can be a common cause for stubborn SIBO-like symptoms or recurrence of symptoms, but this is coming from mold or fungi and not from bacteria. The symptoms can be very similar, even though it's not technically SIBO. So what's the recurrence rate for SIBO? The recurrence rate for SIBO is very high. After SIBO is treated, the recurrence rate can be anywhere from 30 to 60% within 1 year of treatment, according to the research. Let me give you an example of why the recurrence rate might be so high. Say a patient has yeast or candida overgrowth, low stomach acid, and SIBO. With the standard SIBO treatment, you're likely only addressing the bacterial overgrowth and not the yeast or candida overgrowth or low stomach acid, so symptoms are much more likely to recur because all three of these factors can lead to very similar symptoms, and we're only addressing the one factor. So what are the symptoms if SIBO returns? Well, we obviously want to pay attention to what symptoms we're currently experiencing, but here's a list of common SIBO symptoms. Bloating or gas, especially after eating, abdominal pain, constipation, diarrhea, heartburn, indigestion, nausea, fatigue, brain fog, malnutrition, sense of fullness after eating, and more. When we're trying to eliminate the bacterial overgrowth in a SIBO protocol, some people can experience Herxheimer or die-off detox symptoms. This is when the bacteria releases its own toxins called endotoxins, which can cause the immune system to go in overdrive and also makes your liver work harder to be able to detoxify and excrete the toxins. Due to this process, patients can see a temporary increase in their SIBO symptoms, whether that's gas, bloating, constipation, diarrhea, abdominal discomfort, or they can feel flu-like symptoms like body aches, headaches, fatigue, irritability, etc. This response typically lasts a few days up to a few weeks depending on the person. Another thing that can be very common for people with SIBO is a flare in their symptoms. SIBO flares are very common and can happen for several different reasons, such as low stomach acid from chronic stress, H. pylori, use of PPIs, etc. Motility issues, exposure to food triggers, exposure to contaminated food or water, suppression of the immune system after stress, incomplete eradication of the bacterial overgrowth, history of GI surgery, and more. So how long can the SIBO recovery take? In my experience, SIBO recovery can take anywhere from 3 months to well over a year, depending on the individual case. Sometimes it can be a really slow process depending on how many factors are involved, how long the SIBO symptoms have been around for, and how sensitive the person is to foods, medications, and supplements. But there is always hope, and we have seen a lot of patients with SIBO recover and eventually feel great. And lastly, what can we do to manage the recurring SIBO? The most important thing is to build a foundation. The foundation includes the following. Eat a clean, healthy diet that the body tolerates well. Have daily bowel movements and good motility. Provide digestive support if needed, like stomach acid support, digestive enzyme support, and gallbladder and bile support. Manage stress and support adrenal health. Retest the stool using a high-quality stool test on a maintenance basis every 6 to 12 months. And as always, make sure to consult with your functional medicine or healthcare practitioner to find out what's best for you. Well, I hope you learned a little bit today about recurrent SIBO, and until next time, I'm Dr. Paul.